So in this last chapter of bacteria, we're going to take a look at some of the unusual bacteria. So they either have unusual shape, behave weird, they just don't fit into the normal characteristics of bacteria that we've taken a look at. You know, they just don't have the normal gram-negative, gram-positive characteristics with their cell wall, or they don't have the normal coccus or bacillus shape to them. So we put them into our kind of miscellaneous bacteria pathogens. So most of them are gram-negative, but they have a unique shape. And so we're going to take a look at the ones that fit into the Spirochetes or the Curviform bacteria. So they have a curved rod shaped. Some of these also are intracellular parasites. So they have to live inside of our cells in a lab or when they cause infection. And then a group which are gram-positives, which are the mycoplasmas. They lose their cell wall. So that's very unique for a bacteria. So we're going to take a look first at the spirochetes. So they all have a spiral or coil shape to them. They can inhabit multiple places in the body. We can find them in the mouth, the intestinal tract, the genital areas. They can inhabit and cause infection in various animals, but they are strict parasites. They do need to get inside of our cells and in the body, and they will always cause harm to the cells once they get in there. Now, there are three genera of spirochete bacteria that have the spiral shape: the Treponema, the Leptospira, and the Borrelia. Now, usually students are like, nope, haven't heard any of them, more foreign words. A lot of times you haven't heard of the genus or the species names, but you have heard of the disease that these bacteria cause. Starting with the first one that has the Treponema genus, that's the Treponema pallidum, and officially it gets two pallidums, Treponema pallidum. You may not have heard of Treponema pallidum, but you probably have heard of the disease syphilis. So humans are a natural host. We can carry the bacteria, we can spread the bacteria. These particular bacteria, because they need to get inside of our body, they don't survive long outside of a host. So they're extremely sensitive. They're affected by different antibiotics. The most common way it's transmitted from host to host or human to human is sexual, or they can cross the placental barrier. Now, there are different stages of syphilis infection. So after it gets in a new host in the body, it has an incubation period. You're not going to see any signs and symptoms for several weeks. Then you end up going into the primary stage of syphilis. And the primary stage, which can last for several weeks, usually the most common symptom is you're going to get a canker sore at the infection site. And it can last for several weeks and then eventually go away. But the fluid that's coming from that canker sore is highly contagious. Then it can go into, for several weeks, kind of a latency period. The canker sore has gone away. We're not seeing any other symptoms. However, the bacteria still is in the bloodstream. Then we can develop what's known as the secondary syphilis stage, which can last several weeks, if not longer than a month. And this bacteria has gotten into the bloodstream and it's starting to cause damage in the bloodstream. And that generally the main symptom is you're going to have a rash all over the body. And so it can form anywhere on the skin, the palms of the hands, soles of the feet. It can be accompanied by fever, headache, sore throat. Sorry, some of this got cut off a little bit. And the rash, generally, I'm like, it looks painful. And I'm like, it says it doesn't hurt, it doesn't itch, but it can persist for several months. So you're going to have a widespread body rash for several months. Now, still, if left untreated, so this is all if left untreated, it can go away, and it can hang out in the dormancy phase for months, if not years. So the bacteria is gone. We wouldn't find it in the body. Your immune system has taken care of it. However, the bacteria did get in the body, and while it was in the bloodstream, it was doing damage. And so years later, we can develop what's known as the tertiary stage. And this is when we start to have signs and symptoms of the damage that this bacteria has done. You can start to develop neurological symptoms, cardiovascular damage, gumas, which are rubbery lesions on the skin. And so I'm like, there is damage to the nervous system. There can be damage to the cardiovascular system. The problem is at that point, there's really not a lot to do. The bacteria has been gone for years. And so we can't treat with antibiotics because there's nothing to kill. It's the effects of all of the damage that they have done. So if, I'm like, this is if left untreated, that tertiary, those tertiary symptoms can appear. Just some examples of the gumas, those painful swollen tumors, and a lot of times they show up on the face, where you generally don't want them to happen. But it can also damage even the pupils of the eyes. You can have pupils with irregular shapes. Again, this bacteria, it gets into that bloodstream and it can go anywhere in the body and cause damage anywhere. Now, it is a bacteria, too, that can cross that placental barrier. It's called congenital syphilis. Now, it can cross that placental barrier in any of the trimesters. Symptoms of children after they were born with it, and if you Google congenital syphilis, you can get it causes a lot of damage to a fetus. But infants, they can have nasal discharge, skin eruptions, bone deformities, nervous system abnormalities. The late form, depending, more third trimester, you can have damage anywhere in the bones, the eyes, the ears, the joints. And a unique one is it can actually cause more of a barrel shape, a roundness to the tooth. And so I'm like, it can do a lot of damage to infants if mom has it during pregnancy. Now, diagnosing it, a lot of the stages, that primary stage, the dormancy stage or the latency, and even the secondary stage can mimic a lot of other diseases. There's a lot of things that can cause rashes. There's a lot of things that can cause canker sores. And so this is when you have to go based on, what are all the symptoms? What is the patient's medical history? Then they start looking at doing microscopic testing. They can do serological testing. They can do antibody tests. So to look underneath a microscope, they'll try to stain the bacteria. These bacteria are pretty thin, pretty skinny, so they're going to want to stain them to really get a good picture of them. They can even use a silver to make the bacteria stand out as well underneath the microscope. One of the most common antibody tests they do is called a rapid plasmon regen. So it's a serological test. They're looking for antibodies that you may have formed your immune system in response to this particular bacteria. Now, treatment, there are several antibiotics that can do okay jobs. The most effective antibiotic for syphilis, the Treponema, is penicillin. That even individuals that are allergic to penicillin, they may actually try to give you low doses of penicillin because it is so effective. So they're going to monitor, obviously, any possible symptoms that you might have from taking penicillin if you have allergies to it. But their penicillin is by far the most effective antibiotic against this particular bacteria. Now, another of the spirochetes is the leptospira, and causes leptospirosis. These are they're tight individual coils. They usually have a little bend or a hook at an end, and there's really only one that causes a disease. It's the Leptospira interrogans. It causes leptospirosis, and we get it from animals. So animals are carriers of it. So we get it by either eating or drinking something that's been contaminated with urine from an infected animal. Now, it generally causes symptoms: fever, headache, muscle aches, possibly some pink eye, conjunctivitis, vomiting. It's not extremely common, 50 to 60 cases a year. Long-term infections, if left untreated, can cause damage to kidneys and liver. I'm like, it's not a very common bacteria, but it's a bacteria out there. The third genus of bacteria that has that spiral shape is the Borrelia. Now, the most famous Borrelia that causes diseases in humans is Borrelia burgdorferi. And you may not have ever heard the genus and species Borrelia burgdorferi, but I'm going to take a pretty good guess you have heard of the disease, Lyme disease, because it is rampant in this area. Now, it is spread by arthropods. It is spread by ticks in our area. Now, knowing or understanding the life cycle of Lyme disease kind of can help prevent or slow the spread of this particular bacteria. So right away, I'm like, this is spread a lot between insects or ticks and small rodents or animals. So right away, we're you've got an infected tick. But my note, and I'm like, larva tick, right after eggs hatch, are uninfected. So luckily, if there's an infected tick, the eggs don't have the bacteria. So it does kind of always start off as nothing. So that tick is going to hatch. You're going to have a larva. It's going to feed off a small rodent. So first thing it can jump on. That's where it picks it up, because small animals can harbor this bacteria as well. But inside, as that larva starts to develop and grow, that bacteria is also multiplying. And so you have a heavily contaminated nymph. It's growing, still way tiny. So larva, nymph, and then adults, these things are tiny. Now, when they start to grow a little bit larger, they're still going to feed. But this is the point, they are infected. And if they feed on you, whether it's in the nymph or in the adult stage, both, even in the larva stage, it's rare that larva will bite on us. But any of these, once they bite you, they do inject an anticoagulant into you, and that's when they're injecting the bacteria into you. We're accidental hosts. These ticks would rather be eating off animals, small rodents, and deer. And I'm like, but it's where we end up picking up. When the rodent, or when the tick feeds off a deer, that's when it can infect the deer, and it just perpetrates the whole spread. Now, animals don't react to it like we react to it. We end up with all the fun side effects of Lyme disease. It's non-fatal, and it's a slowly progressive syndrome. Now, it can and will cause damage to the neuromuscular system, and it causes inflammation around the joints or rheumatoid conditions. Now, right away, and I'm like some of the initial symptoms, you may get a bullseye rash. Not everyone gets a bullseye rash. Only about 50 to 70% get the bullseye rash, and it might be on your scalp where it's covered by hair and you wouldn't even see it. However, some of the other symptoms, if you don't get that characteristic bullseye rash at the tick bite site, it's fever, headache, stiff neck, dizziness. It's usually, you realize your body's fighting something off. And a lot of times I hear a lot of individuals, they woke up, their joints were swollen, they couldn't move them very well, they were just very stiff. Now, if left untreated still, it can progress and cause both cardiac and neurological symptoms, as well as severe swelling. It causes arthritis, which can cause more long-term damage from that inflammation of the joints. I'm like, the sooner you can get diagnosed and on antibiotics, the better. Because unfortunately, the number of cases in the United States for Lyme disease is on the increase. Partly the bacteria is a hardy bacteria, but we're also moving out into the forest. We're building houses out in the country. And if there are deer around and if there are ticks around, there's a guarantee there is Lyme disease around. Now, when we diagnose it, a lot of a diagnosis starts with signs and symptoms, especially if you have that characteristic bullseye rash. You know you've been bitten by a tick, and you have that bullseye rash, and you're getting, a fever, fatigue. Go in, get diagnosed. It's not a bacteria you want to mess with, because left untreated, it causes lots of issues. Now, they will still try to do a confirmation test. They're usually going to look for antibody tests or even antigen tests. One of the most common diagnostic tests is the Western blot test. If you remember when we went over the Western blot test, the CDC recommends that we show 5 out of the 10 bands for this particular bacteria to make a confirmative diagnosis. However, if a patient comes in, they exhibit all the symptoms, bullseye rash, and you only show 3 or 4 bands, they're still going to diagnose and treat you with antibiotics. Otherwise, a lot of times they're going to look at your titer and look to see, do you have an increase of antibodies against this particular bacteria, indicating that your immune system is ramping up and it's fighting an active infection. Now, it's treatable. We have antibiotics, but again, the sooner you can get treated, the better, because this bacteria can cause permanent damage to both nervous system and to joints. Your best bet is just to not get it in the first place. Prevention, well, if we know it's in the area based on my little map of the United States. We know it's around here. And because we get it from the bite of ticks, is when you go out in the summertime, Make sure you've got bug spray. Make sure it's got DEET in it. They really aren't going to want to bite when they've got that DEET on there. Make sure you've got long pants, long sleeves, light colored clothing so you can see the ticks if they're on your clothing. Doing tick checks, looking for them. Anything to prevent you getting bitten by ticks. That's your best prevention. Now, just a couple other maps to show you where the bacteria is. This is showing that here in Minnesota and Wisconsin, we are at high level risk for picking up this particular bacteria. Some of you may have had Lyme disease, or you probably know someone that's had Lyme disease. This is the most updated map of Wisconsin from the Department of Health Services, is showing that, here in La Crosse County, generally we have, up to 24 cases for every 100,000 people, but our surrounding counties have higher numbers of cases. If you ever travel up north, you're going to have even a higher number of cases. So it's around. Now, our next group of bacteria are the Curviform bacteria. So they don't have a full spiral shape. Instead, they just have more of a curved rod shaped, as shown up in this picture. Now, there are three groups or three genera that all have this curved rod shape. Most of them all like to cause some type of intestinal damage. It's where they like to grow. The Vibrio group, they have a kind of a comma-shaped rod, and they have one flagella on each end. The Campylobacter have more of a short spiral, so it's not a full spiral circle, but they kind of have a little twist to it. And the Helicobacter, they are spirochetes, but still not full spiral. We can't fit them into the spirochete group because they're usually pretty short for a spiral, but they're all going to cause some type of stomach intestinal issue. So we're going to start with the Vibrio. Now, it's Vibrio cholerae, which causes the disease cholera. Now, it's spread. How you would pick up this particular bacteria: ingesting food or water that has this bacteria in it. This bacteria can be found in fresh water, in salt water. It ends up on food, and if food hasn't been properly washed, it's how we end up picking it up. We don't have a lot of cases around here in the Midwest. It's normally found in warmer climates. So if you travel south, it is more commonly found there. But this particular bacteria makes a toxin, the cholera toxin, that affects the intestinal tract, and it causes massive amounts of fluid and electrolyte loss. Now, there's a lot of things that cause diarrhea. We've gone over quite a few, and we've got more coming up when we hit viruses. There's a lot of things that cause diarrhea. However, the diarrhea caused by this particular bacteria is a little more unique because the diarrhea forms what we call as a rice water stool. Now, if you've ever made some rice and you had some extra water that you had to drain off, this happens with some pasta too if you're draining off pasta. That water's not clear anymore. It has a white, cloudy appearance to it. Well, that's what the stool would look like. Normally, diarrhea does not look white, cloudy. That is because of the massive electrolyte loss that's coming with the fluid. Now, just to show you how this toxin is working. So when you ingest any food or beverage that has this particular bacteria, here's the cholera toxin. It's going to bind to the cells of our small intestine. There's your microvilli. Part of the toxin goes into the cells of our small intestine. It's going to activate an enzyme to make something called cyclic AMP, and it's the cyclic AMP that causes the cells of our small intestine to secrete chloride, sodium, and other electrolytes out of the cells and back into that intestinal lumen, so into the intestine. Now, if you learned anything from AMP, wherever electrolytes go, water always follows. And so this toxin is causing massive electrolyte loss. And because the electrolytes are leaving, water is leaving as well. So that's where you get that massive fluid and electrolyte loss. It is that enterotoxin that is causing this fluid and electrolyte loss. And those electrolytes is giving that rice water appearance to it. So diagnosing, it does have a unique diarrhea. Normally you can't just say, oh, they have diarrhea. We'll diagnose it as this. So many things cause diarrhea. However, it's a unique diarrhea. Now, because of the massive fluid and electrolyte loss, and I'm like, there are cases, 1 liter an hour. That's a lot of fluid that leaves the body. Your body can't sustain that fluid and electrolyte loss. And so it has a high fatality rate, because if you can't replace the fluid and electrolyte loss, it will end up killing you. And so the primary treatment is replacing the fluids and electrolytes, because that is what is ultimately what would kill you. We can try to treat with antibiotics. The problem is when your body is having that much fluid and electrolyte loss with diarrhea, the antibiotics that you're taking are going to leave with the diarrhea. And so we can try, but it usually requires high dosage of really strong antibiotics, which can sometimes cause more serious side effects. So it's treating the fluid and electrolyte loss. Best prevention, because it is spread by contaminated water and food sources that have water on them, is proper sewage and water treatment. We do have an oral vaccine out there. It doesn't last very long. It usually requires boosters. But if you know you're going somewhere, traveling somewhere that is having an outbreak or has lots of cases of this, we do have an oral vaccine for it. Now, some other Vibrio pathogens. Again, they're usually tied to some type of water, and these are salt tolerant. There's a Vibrio parahemolyticus that causes gastroenteritis, comes from raw seafood. So if you like your sushi. And then there's a Vibrio vulnificus that comes from raw oysters. Again, these are tied to water. They both cause massive diarrhea, so treating fluids and electrolytes is always the top treatment for anything that causes diarrhea. Occasionally you can give antibiotics, but if you can treat fluids and electrolytes, generally you're still fine. Now, main symptom of a cholera infection, watery diarrhea, particularly that rice water stool. Now, the Campylobacter still has the curved rod, but it kind of has a little twist to it. So it's not full, long spiral, but it does have a twist to it. But they say it usually has more of an S shape to it. It does have a polar flagella, so one on each end. And it is found in a lot of different animals, primarily birds, but it's found in other animals as well. We pick it up by eating contaminated meat. And contaminated poultry is one of the top things, or top ways that humans pick it up. Now, the main Campylobacter that causes disease in humans is Campylobacter jejuni. Based on its name, it does affect the intestinal tract. Remember the jejunum part of the intestinal tract. Now, it causes gastroenteritis. So if you eat contaminated poultry, or you can get it from different beverages, it's not just poultry either, but it does affect the small intestines, and the toxin that it makes does stimulate diarrhea like cholera. Now, other symptoms, headache, fever, abdominal pain, and that diarrhea, other than being very watery, can also include blood in the diarrhea as well. It's damaging the intestinal tract. Now, that bloody, watery diarrhea can last for a week or more. Most often, if someone is suffering from bacterial gastroenteritis caused by this bacteria, they're normally in the hospital. Now, treatment, again, because of that fluid and electrolyte losses, rehydration and electrolyte balance, may give antibiotics to try to get rid of it possibly sooner. Otherwise, your best prevention, making sure food and beverages have been handled properly under sanitary conditions and it is cooked properly. Now, there are two big bacteria that cause gastroenteritis from eating poultry, from chicken. Salmonella is one, Campylobacter is another. Big difference between Salmonella gastroenteritis and Campylobacter gastroenteritis. Salmonella doesn't normally cause the bloody diarrhea, whereas Campylobacter does. And then our third of our curved rod, and again, they don't make a full spiral, they kind of have just a little twist to it, is the Helicobacter pylori. These bacteria affect the stomach. Now, we discovered them not that long ago in the stomach when we biopsied various samples, and it's these bacteria that cause about 90% of all stomach and intestinal ulcers. They also then, because of stomach damage and intestinal damage, are a big cofactor in developing stomach cancers. Now, unique part is people that have type O blood, IBU, have a 1.5 to 2 times higher rate of getting ulcers because of this particular bacteria. They also produce a very unique enzyme called urease that converts urea into ammonium and bicarbonate. And we can test for that. This is showing urease positive tests, it's hot pink, that helps confirm a diagnosis. Now, these bacteria can live and thrive in the stomach. Most bacteria don't like to live in the stomach. There is that really low pH there that inhibits and or kills a lot of bacteria. However, these bacteria can neutralize the stomach acid. Now, our stomach lining has a layer of mucus to protect our own stomach against that acidic environment. Well, these bacteria, they can neutralize the stomach acid, so the acid won't kill them. They can burrow their way through the mucus, and when they do that, they thin that layer of mucus, and then they line the cells of our stomach. Now, because they thin that mucus lining that protects our own stomach against the acid in your stomach starts to cause damage to your stomach itself. And that's where we end up with ulcers. Now, if it damages the stomach enough and it gets to where blood vessels are in the smooth muscle, now you can have bleeding ulcers caused by this bacteria. And so when we treat for it, they're generally going to give you some type of antacids. They want to prevent that damage from the bacteria. They're also going to give you antibiotics to kill the bacteria. So we want to kill the bacteria, but then we also want to stop that acid from doing any more damage with antacids so that you can build your stomach lining back up. Now, some of our other medically important bacteria that are unique because of shape or some other unique characteristic is we've got our Rickettsia group, a Chlamydia group, and our mycoplasmas. The Ricketsias and the Chlamydias are both intracellular, so they have to get inside of cells for them to grow. The Ricketsias are spread by arthropods, so various biting insects. The Chlamydias they alternate between different types of stages and if they're infective or not. And both are gram-negative coccobacilli, so short little bacilli. And then we have our mycoplasmas. And mycoplasmas are unique. They are gram-positive, but they lack a cell wall. Now, gram-positive normally has a really thick cell wall. So genetically, they are a gram-positive bacteria, but they lack a cell wall. Now, because the cell wall can give bacteria shape, they are highly pleomorphic, which means they can change shape. So we're going to start looking first at the Rickettsiae group. So they're all gram-negative. They are a coccobacilli shape, but they have a really thin cell wall, like thinner than normal gram-negative cell walls, and so they can change shape a little bit. So the coccobacilli, some of them are a little bit shorter rods, some are a little bit bigger rods, but they do have a little variable shape change to them. They are intracellular parasites, so they do like to get inside of our cells. We can see some of these in here and grow. And they are going to have some type of arthropod, so ticks, fleas, or lice somewhere in their life cycle. Now, any of these bacteria, they are intracellular. One of the top areas that they like to get into and infect are the cells that line our blood vessels. So they're going to cause damage to our blood vessels. So they can cause inflammation of our blood vessels, leakage of fluid in our blood vessels, and thrombosis, developing blood clots. Now, of all the Ricketsias, there's 3 main Rickettsia bacteria. They are technically all Ricketsias, but only one actually gets the genus name Rickettsia. There's the spotted fever group, there's the Ehrlichiosis group, and the Anaplasmosis group. But we always talk about the Ehrlichiosis and the Anaplasmosis groups together. Now, of the ones that cause the spotted fever, the most common one is the Rocky Mountain spotted fever caused by Rickettsiae, or Rickettsiae. So I'm like, it's got kind of almost the same 2 names in its name. Now, Rickettsiae is spread to us by ticks. So again, it needs an arthropod in its life cycle. Ticks are the common one. And yes, we do have occasional cases here in Wisconsin. No, really rare, however, especially locally. It was in 2018, if we can bring this link up, that La Crosse County had our first case of Rocky Mountain spotted fever. Again, pretty rare around here, and especially here, specifically in the La Crosse County, but it was. Someone picked it up. They didn't know what it was. They had developed the rash, but because they didn't go to the doctor in time, the damage to their cardiovascular system, their blood vessels, was ultimately what caused their death. But they were camping, the kind of long-term camping. It wasn't just a day. They had gotten a tick bite at some point. Otherwise, most of the cases are usually farther south of here, but we do get the occasional case. Now, it again is spread by ticks, and because it damages the blood vessel, one of the main symptoms is a rash. It really is that blood vessel wall is kind of bursting, and you end up with spots all over your body. But it can cause damage to any of your blood vessels, and it can cause damage to your heart as well. So the first symptoms after a bite: fever, chills, headache, and then all of a sudden you're going to have a spotted rash everywhere. Again, because it can damage the cardiovascular system and because it can damage the nervous system as well, if left untreated, the fatality rate is around 20%. That's not great. It means 1 in 5 die of this particular bacteria. I'll go back. If you're going to want to prevent it, just like Lyme's disease, because it's spread by tick, if you can do anything to prevent yourself getting bitten by ticks, wearing the DEET, the long clothing, doing tick checks, all of that, you can prevent the infection. Now, the Ehrlichia and the Anaplasma, these are 2 emerging diseases, so we're starting to see more and more cases of them every year. Still not very common, but based on my little map on here, we do have both. We've got both Ehrlichia and we have Anaplasmas reported here in Wisconsin. Now, they are intracellular parasites. The Anaplasma phagocytophilum actually tells you that phil means like, phagocyte, that's so the eating cells, that this is a bacteria that actually lives inside of phagocytes. It is also spread by ticks. It's also going to damage blood vessels, so you're going to have those same symptoms, the fever, the chills, the headache, and the spotted rash. And just like Rocky Mountain spotted fever, if left undiagnosed and untreated, it can be fatal. This is showing most updated map I could find just for Wisconsin, that yes, we do have cases around here of it. The farther north you go, the more cases there are, but we do have cases of both Ehrlichia and Anaplasma here in Wisconsin and in our area. Now, the organism that causes Rocky Mountain spotted fever, it's transmitted to humans through the bites of ticks. Again, I hate ticks. Now, our next group of organisms is the Chlamydiaceae family. They are small, gram-negative, obligate intracellular parasites. So they still have to live inside of our cells. And they are unique because they have 2 stages to them. They have elementary body and they have reticulate bodies. The elementary bodies are smaller, they're inactive, but this is the infective form. So if you're going to pick up a chlamydia bacteria, you're picking up the elementary body. And so the elementary bodies are what's going to get inside of our cells to cause you to have an infection. However, once it gets inside of our cells, it then turns into a reticulate body, the RB. This is when it starts to grow and divide. So it's not infectious. It's not spreading to new cells. It is, however, actively dividing and growing inside of our cells. And then those elementary bodies can leave and go find new cells. So the elementary bodies are the infective forms, but the reticulate body is the multiplying form. Now, there are a couple strains of chlamydia that cause human disease, but the species is Chlamydia trachomatis. Humans are the carriers of this bacteria, And depending on which strain you pick up and depending on how you pick it up, it depends on, what disease you suffer. There's the trachoma strain that affects usually the eyes. Not always. It can also get in and cause both reproductive and urinary issues. It can also get in and cause issues in the lungs, but it normally attacks the mucous membranes of the eyes. And then we have the lymphogranuloma venereum strain, which is the STD strain because it affects the tissues of the genital area. So for the eye, if we pick up the strain that affects the eyes, it can cause what's known as ocular trachoma. Now, a severe infection can actually deform the eyelids and cause them to turn inside out, which can damage the cornea. Now, when the cornea becomes damaged after a long time, and I'm like, it can and will cause blindness. It's called a non-traumatic blindness because you develop blindness, but it's not because of some traumatic event, a stick in the eye or anything else. It's just this non-stop damage to the cornea. Now, infants can also pick it up. It's called inclusion conjunctivitis. So if mom is suffering from the chlamydia infection during childbirth, the infant can pick it up during childbirth from the vagina, and it can cause a conjunctivitis. It's, again, another reason why right after childbirth, they put antibiotics in the eyes, because there are several things infants can pick up during childbirth. Now, the sexually transmitted form, one, it can cause what's known as chlamydiosis. It's the most prevalent STD. It can cause long-term reproductive damage. Now, I don't know if it's a good thing or not. I'd say not, but in 70% of women, asymptomatic. It's like, yeah, you have no symptoms. However, it means you can be spreading out without having any idea you're carrying the bacteria. And it's about 10% asymptomatic in males. Now, what it can cause in males, it usually causes non-gonococcal urethritis. It's inflammation of the urethra, but it's not from, it's not from gonorrhea. So I'm like, very similar symptoms. You're going to have the painful urination, usually some discharge or pus coming from the urethra. However, if they look at the bacteria underneath the microscope, they're not going to see those cocci-shaped bacteria that the Neisseria gonorrhea have. In women, it usually causes pelvic inflammatory disease, but you're also going to have some type of drainage. It can cause endometriosis, and it can cause salpingitis, where you're going to have inflammation in the reproductive tract. And again, if left untreated, it can cause sterility. It can also cause lymphogranuloma venereum. This is because the external genitalia and the damage to the lymphatic system, it's going to cause inflammation of the lymph nodes closest to the infection site, so closest to the groin area, and it can cause damage to the skin and tissue above those lymph nodes. So we can see inflammation of the lymph nodes closest to the groin site, and you can see damage to the tissue above where those lymph nodes are. Now, identifying this particular bacteria or anything in the Chlamydia family is they're usually going to do some type of immunofluorescence, so we can make the bacteria glow, real easy to see underneath certain microscopes. We can also do PCR different tests looking specifically for the DNA of this bacteria, but they're going to look for the bacteria. They can do, again, different stains called Giemsa stains, iodine stains, anything trying to look for the bacteria itself. Now, the Chlamydophila, it's a new genus. It has members that used to be in the genus Chlamydia. So very similar names because they used to all be grouped together, but slightly different. So the Chlamydophila, and there's two main ones that cause human disease. Chlamydophila pneumoniae, which causes atypical pneumonia. So it doesn't have all the normal pneumonia type symptoms. But for people that have asthma already, it can cause a more serious pneumonia disease. And then Chlamydophila psittaci, it's an ornithosis and ornithotic disease, which means it is a zoonotic disease. It's spread from animal to human, but specifically birds. Anything ornith means bird. So it's spread by birds, It's spread between birds, but if you have contact with birds and they sneeze on you or contact with any infected type of material, it can cause pneumonia and it can cause a flu-like infection, so fever and lung congestion. This is one, again, if you're talking to a patient and they start having pneumonia type symptoms and they start to talk about, oh, they also own birds, it might clue you in that it's a bacterial pneumonia and they could test specifically for this bacteria to know which bacteria is causing it. So again, you learn a lot from the patients by talking to them, finding out hobbies, finding out if they have pets, because all those, finding out your patient has a bird, and I'm like, you wouldn't think is important, but it really can be. It really can help narrow down what could be causing their symptoms. Now, we've got our Cell-Wall-Deficient Bacteria. So they had cell walls, and then they lose them. And so if we gram stain them, they're not going to gram stain correctly because a gram stain is going to show you thick cell wall versus thin cell wall. And they don't have a cell wall. So they are highly pleomorphic, means they can change shape. The cell wall is not going to give them their definite shape. And anything that is in this group, they're the mycoplasmas. Now, the most common mycoplasma that causes human disease is Mycoplasma pneumoniae, and it causes what's known as atypical pneumonia. Same thing, you're going to have some of the pneumonia type symptoms, but it's really slow to grow. Instead of, a couple weeks, it could be a couple months, and it can cause kind of a minor pneumonia. It generally does not hospitalize individuals with this particular pneumonia. So it's kind of just an atypical. It usually causes fever, chest pain, sore throat, almost like having a really bad cold that just doesn't seem to go away. Now, I can come back to this last one, but your atypical symptoms, you're still going to have a runny nose. You're still going to have a weak cough. However, you're generally not going to have all the fluid in your lungs. And it generally is not going to cause extreme fevers. You're usually not going to be in the hospital. Now, because it can cause a runny nose, it is spread by nasal secretions. The top individuals that pick up Mycoplasma pneumonia are kids. They're dirty, they blow their nose, they don't ever wash their hands. And so children between the ages of 5 to 15 are usually the ones that pick up this pneumonia. Now, another nickname, because we call it atypical pneumonia, we also nickname it walking pneumonia, because you can walk around having it. It's not going to cause severe enough symptoms to hospitalize you. Now, diagnosing it, they can do various types of stains. They can do various types of antibody tests. They can, do different types of PCR looking for the DNA. But your best bet is not to get it. Prevention. Good hygiene is the number one way to prevent this particular bacteria. So that's the most common mycoplasma. Again, it's, causes, the fever, the chest pain, the sore throat, maybe a headache, but it's not going to hospitalize you. Now, another mycoplasma, these are rarer, but it's Mycoplasma genitalium and the Uriplasma urolithicum. These are weak sexually transmitted bacteria. So they're out there. They're more STDs to be considered when diagnosing some type of STD, but they're not super common, but they are mycoplasmas. Now, the pictures down here is just showing they can vary in their shape. Some are round, some look like they're smooshing apart. But the interesting part is the cells they cause damage to is they stick to them. That these out here are the bacteria. They don't look round, they don't look rod-shaped. They've almost kind of clump right onto and form right next to the cells. And again, they really do like to get into the respiratory tract, but they can get in different parts of the body as well. So we're going to end right there with our unusual or atypical bacteria. Again, if you have any questions, please send me an email.